My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. Today we will be talking on depression and the lifestyle diseases associated with it. So let's understand what is depression. Depression is basically deep sorrow, long sorrow and helplessness. If your sadness goes long and you feel helpless for a long period, it creates depression. Now it's a serious mental illness issue, and through medicines doctors claim that the symptoms can be controlled, but it is not curable. Our research says it is 100% curable and it should not take more than 100 days to cure even a 10-year-old depression. But firstly, depression does not last for 10 years, and if it lasts, it is sure your mental illness has increased to schizophrenia or bipolar or maybe serious mental illness, more than this also. Now, sadness is very common. There is no human being who does not get sad or who does not cry. But the longevity of sadness and accompanied by helplessness brings depression. Now, what is helplessness? Helplessness means the situation which you are facing, there is no hope that it will improve. Now, listen carefully. When you say the situation which you are facing, there is no hope, doesn't it mean that you are negative? Depression starts from uncertainty. There could be uncertain situations, uncertain events, uncertain things happening in your life. If it creates fear, then you lose your mental balance and you cannot think about the solutions. Depression patient most often complain and blame, find complaint and blame for all its problems. And it is usually either the situations or the events or the person. They constantly blame and complain whatever is happening in their life. To give an example, in one of my training sessions, one of the lady participants was very weak. So I asked her, why you are so weak? She said, in my childhood, my mother gave me only half glass of milk. I told her, now you are 40-year-old, start drinking 2 glasses of milk. But no, they don't want solution. They want to blame whatever is their weaknesses on somebody. In one of the programs, there was a student who came to me who was in depression. He was around 25 years old. So when I listened to his story, his central theme was, I wanted to go to English medium school, but my father put me into vernacular school. Now I asked him, do you listen all whatever your father says? The truth is no. Otherwise depression would not have come. That means people enjoy complaining, people enjoy blaming, and as long as you are complaining and blaming, you cannot have an insight that there is a solution to this problem, and solution always comes with, I am responsible for my problems. If the person is not earning enough, is not able to match his expenses, who is responsible for it? The person himself. Either he has not studied well at the time when he was a student, or is not focusing on work. That's why he is not getting salary. In India also, salaries vary from minimum 10,000 to 10 lakhs per month. Now what salary you are getting, it depends on what performance you are giving, what results you are giving. If you are not giving good results, you may be thrown out of the office also. You will be removed from the job also. You can become a jobless also. And who is responsible? I have heard people who were removed from the job always blaming the management and the politics in the office. The truth is, there is no politics. Management is only interested in the results, and any staff who is not giving sufficient results, he will be removed. But the person who is removed is not willing to look at this angle. And if he looks at this angle, he can improve his performance, and in the next job, he can get a better job and a better salary. Now, does children get depression? Yes. Any person whose uncertain situations is threatening and he gets fear, it's creates insecurity. Insecurity creates fear. Fear creates negative approach. Negative approach creates anxiety. Anxiety creates tension, stress, frustration, and this is a chain reaction. And uncertainty is the part of life. In life, there is no person who doesn't have uncertainty. If you are walking also, there is an uncertainty that you may fall. It can be, bad can also happen with you, and something good can also happen with you. And both are happening with you. But you are focusing only on the bad things. If you look at your life, introspect at your life, from childhood, all the uncertainties have helped you in growth. And there are positive uncertainties also. So if you are fearing, and the very way you can come out of fear is that whatever situation is threatening, if you start looking at it positively, that yes, the situation is bad, but I will get some experience from this situation and I will grow. If you have this attitude, depression cannot come. Now, depression comes only to people who are selfish. Now, this is a statement where no depression patient like this statement. But this is the truth. If you ask 5 people who are close to you, very close to you, and they can be frank, they can be open enough in answering this question, they will tell you the truth. But people are diplomat around you and they are sober and they know it, you are already depressed. What is the sense in telling you the truth? But this is the truth. And depression comes only through negativity. If you are positive in life, you cannot get depression. And a good story I can tell you now. There was a family, mother told one of the children, go and bring the eggs. Now he started complaining and blaming, you are only telling me only, you are not telling the elder brother. But knowing the consequences of not obeying the mother, he went. He went to the shop, he brought eggs, and while coming back on the road, some person on cycle dashed with him and the eggs fell down and it broke. Now a negative person, what he will react and how will a positive person react? Negative person will say, why did mother send me only? Why did this cycle wala dash at me? Why did he dash on the left hand side only where I was carrying that egg? And he will keep on complaining. And what will positive person do? Same situation, he will say, okay, I got it, that I came to bring the eggs. There was somebody coming from the back and accidentally he dashed with me and the eggs fell down. Now the question is, whatever broken eggs are there in that plastic bag, how to use it or to go back to a shop and bring another set of eggs. If you think of whether to make omelette or bhurji of the broken egg, you will not be disappointed. And you have option of going back to a shop and buying another six eggs. What is the cost? But you will spend almost 2 to 3 hours in cursing the cycle wala, in cursing the person who was driving cycle, riding cycle, and the mother and the brother. And when you go home, you will spoil your relation with your mother, with your brother, and a tantrum can be created, and they will also backfire. They will also say something which will hurt you more. And thus the chain reactions of sadness, frustration and depression starts. Now, does woman get more depressed than man? Yes, especially if the woman is housewife, because person who earns dominates, and she is also culturally so bound that she cannot share whatever is the suffering she is undergoing, whatever bad things people have told him, the family members, because she is family oriented, she is relationship oriented. So her greatest interest is to save the relationship, maybe at the cost of suffering. It is no genetic that women are born, there is a hormonal changes, there is a menstrual problem, there is a pregnancy complications, there are children burden. Yes, some stress are God given, but the woman will so happy after being mother that all this stress she takes it very positively, and but just seeing the face of the child, all her stress disappear. Is medicine the only solution for depression? No. I would say medicine is not the solution for depression, because depression is in the mind, in the way you think, and no medicines can go and can cure mind. No medicines. That's why they are saying symptoms are controllable, it is treatable but not curable. Our research says even a 10-year-old depression, which never happens, depression does not last for 10 years. Either it is converted to schizophrenia, bipolar, or a further serious mental illness. Depression is curable minimum in 30 days and maximum 100 days. And it is curable for the lifetime. That means it will never come again. If you go to medicinal treatment, because they are only suppressing the symptoms, and they are saying serotonin has reduced and we want to increase serotonin. Serotonin is basically a happiness hormone. Now, why do you need medicine to be happy? And can medicine make you happy? Just apply logic. How can medicine make you happy or remove your sadness? Yes, the drugs can take you into trance, which the drug addicts always go with afim ganja, but it cannot make you happy, not even for 1 hour. And yes, we have developed the whole technology of making you happy or removing all sadnesses. Now, one more thing. If you are sad, over the period you will become angry, and then the situation will come. Sometimes you will be sad and sometimes you will be angry, and which the doctors will tell you it is bipolar. And if you are fearful and the fear goes for a longer period, then that depression converts into schizophrenia. Now what is schizophrenia? It is hallucination and delusion. Now hallucination means happening or is there, but you say it is there or it is happening. Some noises come in your head, some sounds come, and there is a fear that somebody is there behind the curtain and he has come to murder me or hate me. Now these are basically fears, but doctors say it is hallucination and it is schizophrenia. Even the symptoms of schizophrenia we are capable of removing in less than 100 days. Now very often it is seen that person who is in depression goes to psychiatrist. You also have some lifestyle disease, because the depression doesn't come in one day. We should congratulate you that you have worked very hard to bring depression. Depression doesn't come so easily. There are typical body postures, many things you have to do to bring depression. First is you have to talk slowly. If you talk loudly, depression disappears. You have to always change your posture in a way that you are always looking at the down. You have to walk very slowly. And often I have seen that people bring depression because they want attention. People who are failure in life, people who have guilt, low self-esteem, lack of confidence, they want attention. Any person who is depressed, people come to pamper him. So he enjoys depression because he gets attention. But after some time, he is in the loop and he cannot come out of depression, and that is real depression. Now, attention seeking is a natural human being desire. All the ladies do makeup, all the male also acquire lots of gadgets, good car and good house to get attention. But if you are sad and if you want attention, after some time people stop giving you attention, they start neglecting you, and you go into further depression and you start having negative conversation. Nobody likes me, nobody loves me, people are selfish. As long as the work was there, they were talking with me, and all sort of things which are all negative. If a depressed person takes a tape recorder and for 2 hours record whatever he is talking, he will find the real cause of depression. And the real cause of depression is negativity, fear, stress and tension. And I know it. If he records this for 2 hours, he'll be only blaming people, complaining, only talking negative, egoistic person, serious person, everything he'll take seriously, and there are many such, more than 50 problems, 50 complications which he has got. And this is a simple test of recording your conversation for 2 hours and then listening to it and see what all changes you can make, and it is easy to come out of depression. You have to be only positive. Positive means what? Positive means you are focusing on solutions. Positive means there is a possibility that even if you are a failure, rejected, one day you will be successful and people will accept you. Now this is positivity, and only positivity can help you in coming out of depression. And if you are positive, definitely you will be accepted, your company will be enjoyed by people, and people will like you, people will love you, and you will have good relationship. If you are negative, just the opposite will happen. Does depressed person commit suicide? In majority cases, no. Because depression is not that serious illness that one thinks of suicide. And secondly, depression comes due to fear, and they fear taking such dangerous steps also. Now, does a depression person, if the symptoms are suppressed, can it come again? Yes. If you are relying on medicines because they are successful in reducing the symptoms, and once that medicine is stopped, there are more likely that you will get your depression again. But if you come to us, we treat the depression from the root, and it's unlikely in next 10-20 years you can again go into depression, because we give you technology also. It's like once you know cycling, you cannot forget cycling for next 50 years of your life. Once you know swimming, even if you have not swim for next 30, 40, 50 years, but the day you jump in the water, you know swimming. So our treatment is like that. You will have the technology. Yes, sadness will come, and sometimes helplessness will also come, and sometimes both will also come together. But it will not last long enough that you can be declared as depressed person. Now the next question is, how long the depression lasts? If you rely on the medicines, it will last for a longer period. If you come to us for treatment, it should not take more than 30 days or 100 days, that you should be out of depression for your lifetime. Now let's discuss the lifestyle disease a depressed person has to undergo over the period. The first thing is sleeplessness. A depressed person, even if he takes medicine, he will get insomnia, which is called sleeplessness. That means his sleep will be disturbed. And then you have to add medicine for the sleeplessness also. And that will again have more complications. You will have constipation, you will have obesity, you will be overweight, diabetes, blood pressure, heart complications, and many diseases. It goes on. It's like if you rely on medicines, maybe at the first stage, only one medicine is given. Slowly, you will end up taking 10 to 20 medicines in a day, and the cost of medicines will be more than the cost of food which you take in a day. And you will be lethargic, useless, and isolated, and jobless, and all complications will come to your life. If you are depressed, your physical activity will not be there. And if your physical activity is not there, its complications that also is a chain of reaction complications, and you will not be healthy in life. A depressed person very often eats more and very often eats less also. It depends, your character. Some people overeat when they are sad, some people stop eating when they are sad. And both has got its own consequences or their own health complications. If you are in depression, you are more tempted to go for substance abuse, that is drugs, alcohol, chain smoking, and it also has its own complications. And basically, you will be disturbed in life, not enjoying life, and it will lead to further sadness or further serious mental illnesses. People will not enjoy your company, and there will be a lot of relationship issues. Very often, parent-child relationship or husband-wife relationship gets aggravated if the person is depressed. Nobody can stay with a depressed person for long, and that will bring all the complications of isolation, because human being is a social animal. He wants to spend time with other human beings. If nobody is enjoying spending time with you, life will be horrible. Lastly, there are many psychological stresses which come along with depression, and life will be horrible to live, and you will not make enough money also to sustain your life, and there will be no respect for you in your family, in your relatives, in your friend circles, in your society, for a disease which is curable in 30 days. So is it not spending 30 days with us? And you may start with 10 days. And after 10 days, you can decide whether this is the right technology or not. Even if you watch 5 to 10 videos of mine on YouTube, you will be convinced that I am the authority on treating mental illnesses, and we have 100% success ratio in treating all mental illnesses. The time duration cannot be ascertained because we really don't know since how long the disease is, and after 5 to 7 days only we can come to know the seriousness of illness, and we can predict roughly how much time it will take. But on an average, depression doesn't take more than 100 days and doesn't take less than 30 days for treatment. My name is Dr. Kailash Mantry. I am a life coach and mental health consultant. I practice in Mumbai, India.